Well, as we talked about earlier, we all work really well together. We all do have our own patients that we see. However, on times where, say, Dr. Ridgway may be in the OR or get an emergency case in the morning, if I'm here and available, I would try to go over and see her patients just like she would for myself or any of our other partners. For our OB patients, we all try as hard as we can to deliver our own patients. However, we do share a call, and so the nice thing is that I know that all of my partners are have similar philosophies, and we deliver each other's patients if need be on call. We're all board certified and we're all very highly qualified, and so I feel very comfortable if I can't be there for a delivery that I know my patients will get very well taken care of by one of my partners, and I feel comfortable with that. I love that.
That's great. What does it mean for you, Dr. Ridgway?
Well, I think it's terrific to have such great partners. You know, I don't lose any sleep if I know that I'm going to be out of town on a vacation, knowing that my patients are going to be well cared for. You know, if there's a phone call on a weekend and I'm the person on call for one of Dr. Matthews' patients, you know, I'll treat that patient the same as I would any of my patients, and I know she does the same for me. So it's really terrific to have great partners. When I was pregnant myself, I didn't pick a particular doctor in the practice. The person who delivered both of my babies was the doctor that happened to be on call that night. That's how great I feel about my partners and how much I trust them and enjoy them.
So the nice thing too is, even if, say, I'm on call and I have a question, I know I can always call up one of my partners if it's their patient. If there's any question as to how they would want to handle, or if they would, you know, do anything different, I could call them up even in the middle of the night and say, hey, what do you think about this? Or even if you run
into a difficult situation in the operating room or on labor and delivery, I think we all feel very comfortable that we could call in a partner to help out, and so that doesn't happen in all groups. So I think that degree of cooperation and camaraderie and professionalism is a really special thing about this group.
Yeah, we do it because we care about each other, but also our patients, to give them the best.
Expand a little bit on why that is a value to your patients, that you all don't share on call with another practice, just with each other.
I think it's a value because we know our patients, we know that we give quality care, we know who's taking care of our patients, so we don't want to farm that out to other physicians that we may not know their background, we may not know their philosophy on patient care, and this way we know that our patients are going to get the best care ever. We do have a hospitalist program here at Shawnee Mission, and there are physicians available 24 hours a day there, which is a nice, to be able to offer to our patients if they would come in for an emergency where we would not be readily available. We do utilize that, but not for any other purposes. So.
That's great.
I think also with our electronic medical record, the patient's history is accessible to all 6 of us and readily available. So if there's a particular question, or if it happens to be another physician's patient that I'm not 100% familiar with, I can get on to our electronic medical record, look at that, have access to their complete medical file. I think if you're sharing call between groups, that's not always accessible. So I think that's also an advantage of keeping the call within the group.
So tell me about the billing and insurance. Billing and insurance is always a very important hot topic for many patients. Tell me what sets your office apart in terms of the actions and the steps you all take for your patients in terms of getting their insurance taken care of and billing them correctly.
We have a billing department within our office that has numerous qualified women working in that department. We try to help everybody out with their insurance. We pre-certify our OB, so that takes one stress off of a patient. When you're pregnant, newly pregnant, you have a lot of stresses anyway, so that's one thing they don't have to worry about. We'll call their insurance, and we'll try to help them formulate a payment plan if they need to do that. And just for any other GYN issues, OB issues, we have our billing department that our patients can call if they have questions.
Great.
We'll help you fight with your insurance company. If you need help with your insurance company, we'll help you. They'll help you there too.
Wonderful. So. Great. Good. Very good. You answered that question perfectly. All right. Just a quick discussion about the phone call return policy, the Women's Health Associates. Dr. Ridgway, can you expand just a little bit on that for us?
Well, as phone calls come in throughout the day, the nurses check the voicemail every hour, and so phone calls during the daytime are answered every hour. The phone calls are initially taken by the nurse, but then referred to a physician, usually the patient's physician, for help in answering whatever question or concern those phone calls might reflect. So I think that's a really important point, that although the patient may speak with the nurse, that every single phone call has been run through a physician to make sure that you know, the information that's being provided back is accurate. What else about phone calls? There's an opportunity for patients to indicate that the phone call is an emergency, and those phone calls are taken immediately. After hours, the physician on call is available to answer questions and concerns on an emergency basis that the patients may have. There's always a physician available 24/7 to help patients with their concerns or questions.
Great.
So.
Great. Perfect. Answered it beautifully. Okay. Let's talk about how you guys put your patients first, and it's really about the holistic approach to caring for your patients. I know you offer a lot of things besides just outstanding care. Can you expand a little bit? Dr. Ridgway, we'll start with you, but expand a little bit about the focus on the patients and how you really care for the whole person.
Well, sure. I think that one of the important things that we do is the initial new OB coordinator visit that we offer in the office. It's very much an educational visit. We provide the patient with information that can be used throughout the course of their pregnancy. We, in addition, are offering prenatal yoga classes through the office. We have resources available for even private prenatal classes that, and have the ability to help patients access some of those kinds of things. In addition, we really help to direct them towards educational opportunities that are offered by the hospital, and I think that's a really important thing. We're always available to assist in making appointments for the patient if that becomes a cumbersome process, or if they're not able to make those appointments for themselves. Sometimes it can be a little bit difficult negotiating the system to schedule, for instance, a diagnostic mammogram, particularly in a case where a patient's anxious about some new finding, and our staff is always happy to help with scheduling those appointments. I think that personal touch really
Some of the
makes a
other
difference.
nice things that we have for patients are the ability for them to call in, and if they have emergencies, they can get appointments that day, which is nice because some patients work or have limited time and they need to get in immediately. We also have a lab here for them, so they don't have to run multiple different places to get the studies done that we've asked for them to do.
In-office sonogram, we kind of talked about that before, but that's a really nice addition. In-office non-stress tests for patients who are pregnant that need special monitoring during their pregnancy. We have the ability to do that in our office, so they're not running here and there and thither to get things accomplished.
So they can walk in any time too. Besides us having a lab here, they can walk in any time if they come for a yearly and they want to do fasting labs, and it's 2 p.m. and they obviously haven't fasted, or at least I wouldn't have at 2 p.m. We can, they can come back any day at 9 o'clock here. We have a lab technician, and so they can just walk in. They don't have to make an appointment and get their labs drawn. So I think that's a real convenience for our patients as well.
That's great. Okay, one last question for you both. Dr. Matthews, we'll start with you.
Yes.
When you're not practicing medicine, what makes you tick? What's fun for you outside of your patients?
That's a good question. Right now, right now, honestly, I'm really busy with my family. I have 2 children. I have a 3.5-year-old and an 8-month-old. So honestly, most of my time outside of work right now is spent with my family. But my daughter, especially my 3-year-old, is starting to love to cook, and I'm not a good cook, but I love to cook. I actually love following recipes because I'm not very good at throwing things together around, but we love to do that together. My husband and I, if we get a chance, love to go on vacations. So that's mainly what I do outside of work. It's mostly with my family right now.
And do you lead classes on how to lose weight very quickly after having a
I
baby?
think
You're
she
so
should,
skinny after 8 months. My goodness.
She definitely should.
Dr. Ridgway, same question for you. What makes you tick outside of the office?
I also have 2 children, but I'm at kind of a different place in my life than Kim is. I have a 15-year-old son. He'll be 16 soon and driving. And then I have a 13-year-old daughter. So they're very involved in sports. My son has a black belt in karate and plays soccer year-round and is working on his Eagle Scout. And my daughter's a swimmer and a diver year-round, so between soccer meets and swim meets and things like that, karate tournaments, we stay pretty busy. On our really free time, we like to scuba dive and hike and kind of outdoorsy things. Have a little bit of an interest in wine and good food. So these are all things that we enjoy.
That's great.
Yeah.